Wednesday morning at 9:30. It's January 13th. Um, so we're going to talk about the USDA food guidelines. So good morning again. I never know when it says counts down as 3, 2, 1, and I think I'm on, and then I think I'm not on. So it's kind of hard to tell. So the USDA food guidelines, dietary guidelines for 2020 to 2025. They lasted them in 2015, and they've updated them. Sorry, they have updated them, and so we're going to review some of that. We'll delve into it here in a minute. A lot of people ask me where I get my ideas for these classes. Well, this is one way. I subscribe to Men's Health and Women's Health, and I search around on Healthline a lot, and then I search the National Institute of Health. So we're going to delve into the dietary guidelines for 2020 to 2025, and then we're going to explore that a little bit more Friday and probably Monday, because Men's Health does have an interesting article about this, specifically about saturated fat. So things have changed a little bit. So we're going to go down and look at the actual guidelines. I'm going to tell you what they say. So there's an executive summary. It's a 142-page guideline. So there's 4 main guidelines. And it's listed, the guideline says make every bite count with dietary guidelines for Americans, and here's how to do it. So number 1, follow a healthy dietary pattern at every life stage. So they go all the way from newborns all the way to elderly people in this guideline. And I'm not going to go through each 142 pages. This is the gist of the guidelines. So at every life stage, they're saying that infancy, toddlers, childhood, adolescence, adulthood, pregnancy, lactation, and older adulthood is what, they're going the whole gamut from life to the end of life. So they're saying for about the first 6 months of life, exclusively feed infants human milk. So that is the best way that infants, that's how they get some of their IgA and immunity built up from human milk. And then continuing to feed infants human milk through at least the first year of life, longer if desired. When I was on pediatrics rotation at the University of Missouri, there was a woman brought her five-year-old son who kept, she was still breastfeeding him. So during the office visit, this little guy kept trying to lift her shirt to get to her breast. So she believed in the power of human milk. And then if that's not available, meaning you don't want to do it, or you don't have time to do it, or you just don't want to do it, those babies should have iron fortified infant formula during the first year of life. And then providing infants with supplemental vitamin D beginning soon after birth. So there's the importance of vitamin D, starting that early. And then continuing as you get older. Most people, they might not be vitamin D deficient, but I saw a report where 80% of ICU COVID patients were considered vitamin deficient, meaning their vitamin D 125 level, 125 OH level was less than 20. Insufficient is less than 30. Normal is 30 to 100, and ideal is about 65 on that test. And then at about 6 months, you introduce babies to nutrient-dense complementary foods. So introducing infants to potentially allergenic foods along with other complementary foods, and hopefully getting a variety of foods from all the food groups, with foods that are rich in iron and zinc, particularly for infants that are on human milk. And then from 12 months to older adulthood, following a healthy dietary pattern across the lifespan to meet nutrient needs. And it's interesting, this is kind of the first time that they actually talk about what they think, morning Linda, what they think is a balanced diet. So when you go through these, you'll see some of the things that I've been telling you about that have now made it into the USDA guidelines. Number 2, customize and enjoy nutrient-dense food and beverage choices to reflect personal preferences, cultural traditions, and budget considerations. So personal preference is part of the deal. That's in this article in Men's Health that we'll discuss on Friday. So there's two sides, of course, to every story and camp on these guidelines. So the Men's Health article really does go through this in a pretty fair way, I think. And personal preference becomes, at the end of the article, some of these nutritionists basically are saying if you don't take into account personal preference, you really can't come up with a balanced diet. Also, the cultural tradition. So a healthy dietary pattern, and we'll discuss that on Friday as well, can benefit all individuals regardless of age, race, or ethnicity, or their current health status. So these guidelines provide a framework intended to be customized to individual needs and preferences, as well as the foodways of the diverse cultures in the United States. Number 3, USDA guidelines. Focus on meeting food group needs with nutrient-dense foods and beverages and stay within calorie limits. That doesn't, if you're doing intermittent fasting, Jason Fung's program, which I refer to all the time, he doesn't think counting calories is necessary if you're in your feasting window. So you eat until you're full and you take your time. So it takes 20 minutes for your brain to tell that for your gut to tell your brain that it's full. So on number 3, they say an underlying premise of the guidelines is that nutritional needs should be met primarily from foods and beverages, specifically nutrient-dense foods and beverages. We'll talk about that on Friday or Monday. Nutrient-dense foods provide minerals and vitamins and other health-promoting components. They have little or no added sugars. There's the change. Saturated fats, that's what we're going to talk about on Friday, and sodium. A healthy dietary pattern consists of nutrient-dense forms of foods and beverages across all food groups in recommended amounts and within calorie limits. So the core elements of what they're saying for nutrient-dense foods are vegetables of all types, so dark green, red, and orange, beans, peas, lentils, starches, and other vegetables. Number 2, fruits, especially whole fruit. Number 3 on this list, grains, at least half of which are whole grain foods. Number 4, dairy, including fat-free or low-fat milk, yogurt, and cheese, or lactose-free versions, and fortified soy beverages and yogurts as alternatives. Soy, 20% of people are soy intolerant, so that can be a problem. Number 5, under the number 3 guideline, is protein foods, including lean meat, poultry and eggs, seafood, beans, peas, and lentils, and nuts, seeds, and soy products. Again, soy intolerance is 20% of us. And then oils, including vegetable oils and oils in foods such as seafood and nuts. So number 4, there's 4 guidelines and then 142 pages, or 135 pages explaining them all. So here's where it gets interesting. Limit foods and beverages higher in added sugars. So remember, we've been told to get most of our calories dating back to 1978 based on that Ansel Keys research. Avoid saturated fat, load up on carbs. So now they're saying limit foods and beverages higher in added sugars, saturated fat, again, we'll talk about that on Friday, and sodium, and limit alcoholic beverages. So at every stage of life, they say meeting food recommendations, even with nutrient-dense choices, requires most of a person's daily calorie needs or calorie needs and sodium limits. So they're saying a healthy dietary pattern does not have much room for extra added sugars. Of course, you got to read labels and see how much sugars that aren't added, and they usually tell you added sugars versus what's in there. So fruit juice is notorious, 28 grams of sugar per serving, but there's no added sugar sometimes. And they also clink on saturated fat and sodium, or for alcoholic beverages. So a small amount of added sugars, saturated fat, or sodium can be added to help meet food group recommendations, but foods and beverages high in these components should be limited. The limits are added sugars less than 10% of calories per day starting at age 2. Avoid foods and beverages with added sugars for those younger than age 2. And interesting, they don't say for the rest of your life. They're focused on 2 or less, age 2 or less. Saturated fat, less than 10% of calories per day starting at age 2. Sodium, less than 2,300 milligrams per day. Even less for children less than 14. Alcoholic beverages. Adults of legal drinking age can choose not to drink or drink in moderation by limiting intake to 2 drinks or less in a day for men and 1 drink or less in a day for women when alcohol is consumed. Drinking less is better for health than drinking more, and there are some people that shouldn't drink at all, specifically women who are pregnant. So for most individuals, they're saying no matter age or health status, achieving a dietary healthy pattern of eating will require changes in food and beverage choices. And that's what we'll talk about on Friday from this Men's Health article. So you can make simple substitutions. Others require greater effort to accomplish a change in their diet. This guideline is an overall guidance on choosing nutrient-dense foods and beverages in place of less healthy choices, and also discussing specific and special nutrition considerations for individuals at each life stage. So infants, toddlers, children, adolescents, adults, women who are pregnant or lactating, and then older adults. Okay. So ultimately, you decide what and how much you're going to eat or drink, and and they also, yeah, of course, you have a choice on your personal relationships. That's all in here. The settings in which people live, learn, work, play, and gather, which isn't happening right now, and then the other contextual factors, including the ability to consistently access healthy and affordable food. So that strongly influences everybody's choices. So health professionals, communities, businesses, industries, organizations, and government, as well as other segments of society, all have a role to play in supporting individuals and families in making choices that are considered healthy dietary patterns, and then ensuring that all people have access to healthy and affordable food. So that's kind of the gist of the guidelines. I did it in 14 minutes. Good morning, Shelley, and good morning, Eileen. So we're going to expand on this on Friday morning at 9:30. But specifically, now think about the difference between saturated fats. So they point out, this one nutritionist points out in this article, you can get dietary fat, saturated fat in your diet, which they're saying is less than 10% of your intake. So they're still sticking with the less saturated fat, the better, but it's not quite as restrictive as it sounds. So the nutritionist in this article says, well, you can get saturated fat from lean meat or steak or ice cream. Well, ice cream has added sugars, that kind of defeats the purpose of the guidelines. But a typical current USDA dietary guidelines recommending the average active, says man, no more than 10% of daily calories. So here's what that looks like. So that would be 3 scrambled eggs, that's 6.6 grams of saturated fat, 2 slices of bacon, high protein on that, 11 grams of protein, 2 grams of saturated fat, 1 full-fat plain Greek yogurt. So Dr. Fung, in his dietary recommendations, says skip the low-fat type of yogurt, get the full fat type of yogurt. So that would be one 5.3 ounce serving, or a New York strip steak broiled at 6 ounces with a pat of butter on it. So that's 5 grams of saturated fat from the steak and 2.5 grams from the butter, and then 1 cup of whole milk at 4.5 grams of saturated fat. So we'll go through the the ins and outs and the 2 different sides of those USDA guidelines on Friday, after I review this article and look up some more stuff, so I can I can kind of back up what we're talking about. So that is the basic gist of the USDA new dietary guidelines. That's for the next 5 years. Presumably they would do it again in 2026. They did it in 2015. They were still recommending carbohydrates. In this one, not so much. They've kind of changed their tune a little bit. So I will see you Friday. I'm going to run to my doctor's appointment and make sure that my blood pressure isn't going to stroke me out. And I will talk to you Friday morning at 9:30. See you later. Bye. Have a good day.